I think one of the biggest things that new agents don't consider is that if you're using a community partner, you only have to have the relationship with that one person. They already have, like, let's just say a dental office, they already have a relationship with all of their patients. And so if that office manager refers them to you, speed of trust is already there. So it's a lot quicker to get through the appointment and a lot more likely that you're going to close almost 100% of them.
Ladies and gentlemen, welcome back to the Medicare Sales Playbook. I'm your host, Dallas Keithley. And man, you guys have been absolutely making my day, my week, my month. All the comments, all the likes, all the subscriptions, all that. You guys have been killing it. Please keep that up. Our goal here, if you're new here, our goal is to help Medicare agents increase their book, increase their sales, increase their business one play at a time. And the way that you can help us do that is by sharing the program, is by sharing and telling your friends about it, tell your enemies about it, right? Like anybody you can tell about it that's in the Medicare business, we want to speak to them. We've had a lot of great guests on. We know that this is the busy time of year for everybody. So the time that you take to listen to this really means a lot to us. So as we go into AEP, keep listening, keep subscribing. We'll be that bright spot during AEP that gets you through it. So another thing that I want to jump to before we get to our guest, we have been hosting webinars. The last Wednesday of every month, we have been hosting a webinar that takes a deeper dive with one of our guests. We had Casey Askins on. She talked about Medicare seminars and really got in depth into it. And there's only one way to hear that, and that is to be there live. It's the last Wednesday of every month at 4:00. If you would like to be included in that, just shoot me an email. It's dallas.keithley@medicaresalesplaybook.com. We'll get you on the list and make sure you're on the next one. So all that being said, you talk about a deep dive. We have someone on here today that is someone we've been efforting for a minute. She's busy, believe it or not. But I've known this lady for several years now, and she is building one of the fastest growing Medicare agencies in Colorado. And Amanda is with us today. Amanda Matthews, welcome to the show. Thank you for being on.
Hi, Dallas. Thanks for inviting me.
Absolutely. Yeah. I think this is like the third or fourth time we've tried to have Amanda on. And she's like, well, I've got 6 minutes here and 4 minutes here and 2 minutes. I'm like, Amanda, just come on, help the people. Right.
It's go kind of life. Yep.
It is. It is. Now, Amanda, you are out there you're in Littleton, Colorado, correct? Just outside of Denver?
Correct. Yep.
Yeah. And Integrity Insurance out there in Littleton, Colorado, doing big things. And man, Amanda, I have got to watch you over the last, 4 years, probably 3 or 4 years, transition from and do it very successfully, which is rare, transition from being a full-time agent, writing, to being a business owner that is helping other agents and growing other agents. And you've done it very systematically, very on purpose. And talk a little bit about what that transition has been like for you.
Well, I was in a captive role for a long time. And so when you first leave that industry, start back at zero. So I've been there with all the new agents at zero.
Mm-hmm.
And so, yes, the easiest way to bounce back to the income that I wanted was to do a lot of selling myself. And then I was in management for quite a while before, so I knew I had the ability to help grow other agents pretty quickly and successfully. Our goal is to get new agents to a 6-figure income within the 3-year mark, which is totally doable with the right support.
Yeah. And what's cool is Amanda is the fact that you have seen it and done it from all angles, right? So when you do that, that allows you to understand what the agent is going through. Like, you've been a captive agent, you left the captive agency, it's had zero, built that up, had the struggles, had the marketing struggles, all of that. So when an agent comes to you, that allows you to be like, yeah, I've been there. Here's what I did, rather than just here's what you do. Right.
Yes. And I still do some writing, which I like because it keeps me tied a little closer to, and just knowing what agents are dealing with in the field these days, because it does change a little bit.
It does. Yeah. Oh, there's, as we sit here, yesterday was kind of a big day in the Medicare world. You and I were at an event together, and I had probably 10 agents come to me and say, "Hey, are you seeing the change that are dropping this year?" Right. And here's one thing I like about Amanda. We didn't even plan on talking about this, but here we are. One thing I like about Amanda, you stay positive. And a lot of agents come up to me and they're like, "Oh, this is going to be a horrible year. This is dropping. This is changing. This company's not paying commission. This company's dropping this plan. It's going to be bad, bad, bad." How do you maintain a positive attitude when stuff like that happens?
Well, all of those negative Nellies, I anticipate that they'll want to leave the Medicare industry altogether. So I just plan on scooping up all those clients.
Yeah,
Now, I mean, I think Medicare is an industry you really shouldn't be in if you don't like change, because there is so much change all the time, so much compliance. But it's been a really good career path for me, and I like it. It's doing good things for people while making great money.
that's on. Yeah, that sums up Amanda Matthews right there, doing good things for people while making great money. And I love that. So here's what we want to kind of get to today. Amanda and I talked, and we were thinking about how can we best utilize Amanda's talents and her wisdom. And here's what we came up with. Amanda, I kind of want to show the folks you have a great agency. You have great agency training. You are able to get in front of people on a regular basis, and then you maintain that relationship and retain that client as well. So, want to talk today about just kind of from beginning to retaining the client, your system. So, let's start in the beginning. How are you? I know there's several ways to do it, but how are you and your agents mostly getting in front of clients?
The Lots of different ways, actually. For me, well, I think the choice is always time or money, right? If you have time, then you go build community partnerships. If you have money, you can buy leads. Of the two, I like the community partnerships better, and it's worked for me. I still get tons of referrals from our partners. I think one of the biggest things that new agents don't consider is that if you're using a community partner, you only have to have the relationship with that one person. They already have, like, let's just say a dental office, they already have a relationship with all of their patients. And so if that office manager refers them to you, speed of trust is already there. So
Hmm.
it's a lot quicker to get through the appointment, and a lot more likely that you're going to close almost 100% of them.
Yeah. Yeah. So what you're saying is you establish a relationship with someone that your client trusts. Therefore, that trust is then passed on to you because they have said, "Yeah, this is the lady you go see."
Yeah, I mean, they're vouching for you. They're vouching, all the experiences they've had with you. And then I like to also create that feedback loop. So when I do help the person that they had referred to me, I say, "Hey, this is a newer relationship for me. Would you mind going back and telling them that we did a great job for you?" And so it just kind of keeps that wheel going.
Wow. Yeah. So they trust you. You build the relationship with them. Then you build the relationship with the client. Then that circle goes back to you making sure the client and the dentist or whatever it may be understand that you did what was best for them. And so it's
Correct.
like I love the circle term. It just keeps rolling because then
Yep.
they're going to send you more people.
Yep. Yep. I haven't done
Okay.
community based marketing in almost 4 years, and I still get tons of referrals from my community partners that I built many years ago.
Boy, and if you could pick one way to build a business, referrals are not a bad way to go. It's
Agreed.
yeah, it just keeps giving and giving and giving. Yeah, I love that. Okay. So now let's say we're sitting in front of a client. You have developed something you call the Medicare, I'm looking at here, the Medicare Decision Tree,
Yes.
which I'm looking at this. This is absolutely brilliant because what I'm seeing here is a laid out system that, a lot of people sit in front of a client and they're just kind of like, give them all the information and then sit back and hope they make a decision. You have got a process that if you do this, it goes here. If you do this, it goes here. And guys, we're going to put this up on the screen. If you're watching on YouTube and all that, we'll have that up here. We're popping that up as she talks about it. But we're also going to make it downloadable so that Adam and his team will be putting that there so you can go grab it. If you're watching on Amazon or listening, sorry, on Amazon, Spotify, Apple, and you're not watching, you can go back and grab that later. So, but this is something that you really should be using. So Amanda, talk about how did this Medicare decision tree come to be?
Well, there are a lot of different steps, about five that I identify within the sales process, and in particular for a Medicare plan, like either a Medicare Advantage or supplement. We try to be completely unbiased. I don't ever push my clients one way or another. We give
Thank you.
them the choice.
Yeah.
But I've done hundreds of ride alongs with other agents. And I think one of the most challenging agents for both new and tenured is they'll get in a home and either they push their own preferences on somebody, or they don't really let the client choose. And my thought is, if the person really wanted a supplement and you wrote a Medicare Advantage plan, the next agent in the door is going to get that. Another folly I see is that a lot of times agents will put out, three or four different summaries of benefits, trying to explain all of them and making the person choose. And if you present more than one, they're not going to make a decision at that point in time. You're going to have to go back for a second appointment, and that's completely unnecessary with this.
Yeah. Having too much information, because I think the biggest fear with Medicare clients, we've talked about this a lot on this show. The biggest fear for Medicare clients is choosing the wrong plan. And if you give them too many choices, that just feeds that fear of, man, I'm going to make a wrong decision here. So you as the expert can narrow it down. Talk about how do you narrow it down? I know listening is a big key to it. How do you narrow that down to get it to one or two summary of benefits?
Yeah, and just maybe this would be a good time for Adam to kind of flash up the Medicare Decision Tree itself, so you can see what I'm referencing here. But on this Medicare Decision Tree, the first two pages, the first one's just kind of an empty chart, and the second one has all the questions that you should ask. And with this flow, at the end, you'll only come down to one product to present to the client. I do make all of our agents, follow this to a T. This is what we role play off of. And, I was saying for the first 20 appointments, at least, you have to follow this without variation. After times they get better and better, they can add their own flair to it. But if you follow this to a T and ask all of the questions that are in bold, it will get you down to one plan, and you'll close the sale right then and there. Now, I do have to caution, because a lot of times people will say, well, can I just show them this chart with all these like empty squares? And the answer is no. Really, you should be just drawing this out. And that's what I did for decades. I still do it with my clients. I just draw it out. The problem is, if they see all these little blank squares over here, they're going to want to know what each one is about.
Yeah.
And you don't want to spend all day explaining that. You just want to get in, give them the plan that they need and want, and move on.
Yeah. And I want to back up to something you said there. You make your agents do it. Here's what's fun. Here's what I find somewhat funny, somewhat frustrating. New agents come in and they're like, we need help. I need help. I need help. And I'm like, okay, here's what you do. And they're like, I'm not going to do it that way. Right. Like, okay, you came to me for help, right? Like so I love that you're like, guys, if you're new here and you're struggling, go to someone like an Amanda Matthews and say, hey, I need help. And then whatever they tell you to do it. When it comes to presenting, in my opinion, you memorize the presentation, you memorize, and then you personalize. If you try to personalize first, it's going to get in the way of the presentation. So I love that you said that. That's good stuff right there. So let's do this. Let's role play if we can. I'll be the client.
Okay.
We'll see how this works. Amanda's like, Dallas, I need all the list of questions you're going to ask. I'm like, Amanda, that's not how Dallas rolls. If I try to prepare too much, it's awful. So we have not prepared this. We have not planned this, but let's role play and just see how it goes.
Okay. Sounds good.
So we've got the Medicare tree there. Here we go.
So we've already gone through the warm up. We've already gone through a little bit of the needs analysis. Hey, Dallas, let me ask you, how familiar are you with Medicare?
I know I got to be 65. I know I have to have it. That's about it.
Okay. Well, let me back up and give you just kind of a high level, and then we'll move on to which plan might be a better fit for you. So Part A of Medicare is what you paid in when you were working, and your employer paid in also. And then Part B is the $185 a month that you pay out of your Social Security check every month. Technically, that A and B is, that's what we call original Medicare, and it is insurance. It's just not very good insurance. And for that reason, everyone chooses one of two options for extra coverage. Both options are great, and the goal of both is to protect you from the high out of pocket costs of original Medicare. The one that's the better fit for you is really going to depend on how you prefer to receive your care. Does that make sense so far?
Yes, ma'am. Yep.
Okay, so the two routes that people can go, option number one is a Medicare Advantage plan. And Medicare Advantage plans generally have little or no monthly premium. They do use networks of doctors and hospitals. You have co-pays as you go along, very similar to a group plan. And prescription drug coverage, Part D, is included. A lot of times you'll see extra benefits like dental, vision, hearing, over-the-counter benefits as well. Alternatively, you can get a Medicare supplement plan and a Part D plan. It's also a good option. It just works completely opposite of the Medicare Advantage plan. So what you're going to see on the supplements is a high monthly premium, and those do increase about 10% annually. The benefit is that there's no network of doctors and hospitals. You pay very few or no co-pays, and only the Part B deductible, which is $257 this year. On the supplements, the Part D is not included, so we would add that on separately. And you would have to add on the dental, vision, hearing, those extra benefits separately as well. So based on what we've covered so far, are you leaning more towards a Medicare Advantage plan with lower premiums, lots of extras, but you do have co-pays? Or do you prefer a supplement plan with a higher premium but no network or co-pays?
I'm probably the Advantage plan. I'd rather pay less, and I like all the
Okay.
extra stuff too. Yeah.
Okay, perfect. On the Medicare Advantage plans, there are two primary types. There are HMOs and PPOs. So let's kind of define the differences here between those two. With an HMO, you've got a set network of doctors and hospitals. Generally, if you're willing to stay within that network, you're going to see lower premiums, lower copays, and more added benefits. Once in a while, HMOs do require referrals. Not so much in our area, but on some plans they do. And you'll also select your primary care doctor. Their name will be listed on your ID card. On the PPO plans, it does also have a network, but you have the flexibility to go outside of that network, usually for a much higher copay. The higher it will have higher premiums and copays overall than the HMOs as well, and also not as many added benefits. Another thing that people like about PPO sometimes is that there are no referrals and you don't have to list the primary care on the ID card. So, of these two, which is more appealing to you? The HMO with are you willing to stay within the network and get lower costs and more benefits? Or do you really like that idea of the added flexibility of going to non-network doctors?
I've been going to the same doctor for 28 years, so HMO works for me.
Okay, yep, and I already looked them up. They are in the network, so you're good to go there. So some HMOs do require referrals and others don't. The good news is they're really pretty easy and most of the time done behind the scenes by the doctor's office. Is this an important consideration for you?
Nah, not really.
No. Okay, perfect.
Yeah.
In that case, there are two health plans that would work great for you based on what we've discussed so far. And this is where we would hopefully already have looked up the doctors and hospitals if we had that information and prescriptions. So let's just say you got company A and company B. Do you have a strong like or dislike of any of these companies?
Nope. I trust your decision.
Okay, and I'm sure you've seen the commercials, so you know that on Medicare Advantage plans, there are some extra benefits that can be included. Is it important for you to have any extra benefits like dental coverage, vision, healthy food card, anything like that?
Vision's very important to me.
Okay, great. Both of these plans actually have really good vision coverage. Is there anything else that's important to you?
No, not just real. As long as I can go to my doctor and have good eye coverage, I'm good to go.
Okay. Well, let's look at company A then, because it does have a little bit lower copays overall and lower maximum out of pocket, and it includes great vision coverage as well as your doctor. So based on everything that you've told me, I think this is going to be the one to go with. Sound good?
Perfect. That
All
works.
right, let's hop into the actual copays then, so you can see how the plan operates.
Wow. Guys, I hope you're paying attention. Here's the deal. Amanda, how long have you been doing a Medicare?
Just had my 20th anniversary last week. It's like a
20th anniversary.
dinosaur.
Yep. Amanda it didn't sound like you were reading, but I know I can see you're still reading a script at 20 years in. Why?
Well, I can do this in my sleep actually. So,
Right.
but I wanted to illustrate that if you ask those questions and you let them answer, they're guiding the ship,
Right.
which is what it should be. At no point should an agent be pointing them one direction or another. But really, the goal again is to get it down to one plan, so you're not like overwhelming them, overloading them with information, and you can close that sale. In almost all cases, these should be one appointment closes.
And a couple things I wrote it down a few things. Number one, you ask questions, right? But you ask questions that led somewhere. I
Yes.
love, and because you did that, you kept me engaged. Me as the client, you kept me in. You checked on my understanding. Are you following me? Are you with me? What do you think of this? What do you think of that? However, one thing that's almost a difficult thing to do is sometimes people ask questions, and then if you've got to talk, and I was a very easy client, right? Like for sake of time,
Yes.
I'm just like this, this,
As you
this.
should be for a new role playing partner.
Exactly. Yeah. Now, and guys, one thing that I always hate about instructional videos, they're like, you do this, you do this, you do this. It works every time. Does it work every time? Absolutely not. Right. But if you follow a pattern, it will lead to the result most of the time. Right. So, but one thing that's hard about asking questions is retaining control of the interview. I like that you asked me questions, but you still led the interview. Like you
Yes.
kept me on track, kept me on the path. And you guys, you're going to have that client that takes you down a rabbit hole about what happened in World War II and all that. Like we get that. But this keeps both you and the client on track, which is kind of the purpose, correct?
Yeah, and really, I don't let the clients go to the next level without first answering that question. So if they try to distract me, we always bring them back. They have to answer the bolded question before they go to the next section.
Yeah.
Because you don't want to get down to like level 6 and then they're like, wait, remind me again how Medicare works and why I can't use that. Like,
Right. Yeah.
uh, yeah,
It's kind of like I had a guy tell me this. He said it's kind of like Mario Brothers. You can't play level 3 till you beat level 1 and 2. And
exactly,
sometimes
exactly.
we do that, and that helps my brain understand it, right? Like sometimes we do that. We're over here trying to defeat the dragon on level 6 and, save the princess, and we don't know how to hit the blocks with our head yet, which this is
Yep,
the dumbest
exactly.
analogy I've ever used, but it works, right? So I love that you are making them go through the process. And like I said, guys, have a system, have a process. Every professional out there has a system and a process. I went and had my oil change the other day and I watched the guy click through, like I can see it. He is clicking through the steps. Is the car in park, right? Have I explained the details to the client? Have I asked them which oil they prefer? And he's clicking through that. And I asked him, I said, how long have you been doing this? He said, oh, like 25 years. And I'm like, yeah, but that keeps you on track, doesn't it? He goes, yeah, it does. It really does. So I
Yep.
appreciate that. So, okay. So we've got the client now. The client is in our system. They're our client now. We all know the reason we do Medicare is for that retention and that residual income. So you have established something else here that you and your client, or I'm sorry, you and your agents both follow. And we're going to put this up here too. She's got a sheet that on the top of it, it says every client, every time. Talk to me about how this came to be and why it came to be.
Um, well, first things first, if you haven't put two and two together, every current member you have is worth as much as a new member, assuming it's not somebody turning 65 or coming off group or whatever. but every member that you currently have is worth as much as a new member to you. So the other thing is you can cross sell them more often. They give you more referrals. That all sorts of things that your current clients will do for you. They'll leave Google reviews, which brings more leads in the door. So we want to take amazing care of our clients. Also, when you're a new agent and you retain 95% of your 100 client book of business, you're only losing 5 people in AEP. But as you grow, you might have 1,000 people, and that suddenly becomes 50 just to break even. You have to replace those 50 lost clients with 50 new clients just before you're making the same amount the following year. So it's key to really pay attention to the clients that you already have. They're amazing for a lot of different reasons, and it's so much easier and less expensive to retain them. So we have, I mean, if I ask you, so I'm an agent, Dallas, who do you think my competition is?
Oh, well, television commercials, right? The
Okay.
carriers themselves calling clients and trying to replace business or whatever. Other agents out there, honestly, I don't think other agents in your area are too much competition because I don't think people are doing what you are doing. But I would say your biggest one is probably just media, phone calls, telemarketing centers, that kind of stuff, and
Right.
death.
And death, yeah, death is a
If you
problem
figure out how to
sometimes.
replace that one, we're all right.
Yeah, I know they need to lower that Medicare age to 50. That'll help me out a little.
There you go.
So, yeah, and that is all true. That's usually the answers that we get. The what I would say is that there are only a few different places where you can actually, you know, compete on. Product is one, and since we don't create any of those, are not really competing on product. The big carriers are. Operations is another, and then customer service is the last one. And that is the one, especially for a Medicare agent, that we have the easiest time competing on. Our competition, to me, my competition is anyone who delivers exemplary customer service. So we're thinking like Chick-fil-A, Disney, USAA, all of these big companies with tremendous customer service. You hear the stories over and over. So for our team, we had to kind of define what that looks like. It's not written on the sheet, but for example, our admins answer over 90% of our calls live. And the remaining 10% or less, it's not even that high, they get a call back within 30 minutes. So we don't leave these people hanging. There's no chance they're going to go to a competitor. And if they're a client of ours, we pick up the phone and greet them by name. Like, hey, Stephanie, this is Amanda. How are you doing today? Very, very
That's
friendly.
Awesome. Yeah, you and I just went to an event yesterday, and I don't know, I'm sure you noticed it. The above and beyond customer service blew me away.
Every minute detail was thought through. I was kind of comparing that meeting to like the Broadmoor, a big hotel in Colorado, big fancy, when I was there last summer, and it was flawless. There was no wallpaper peeled up, no stain on any carpet. It was flawless, and people notice.
Yeah. And I was walking, just to give you an idea, I was walking through looking for someone. And this young lady is going to get a drink. She stops. Now, this young lady does not know me, has nothing to do with what I'm trying to do. She works in a different department. I found out she worked in the broadcast department of this group. And she comes over and she says, "Hey, you look like you're looking for someone. Can I help you?" And I asked her, I said, "Why'd you do that?" She goes, "We've been told never let someone look like they're looking for something." And I'm like, "Well, go get your drink first." She goes, No, let's find who you're looking for." And then took me to the person and said, "Here you go. Is this who you're looking for?" "Yeah." And then went back and got her drink. And I'm like, man, so I asked the lady that trains their hospitality team, I'm like, "How did you do that?" She said 2 words: on purpose. We do it on purpose. It's not an accident. It's not like we hope they'll do this. She said, we train and train and train ad nauseum on how to do it. So let's go over some of these. Um, every client, every time it says interactions are always upbeat and positive.
Yes.
I
If we're
think
having a
we
bad
could
day, we
stop
don't want
there.
that. Yeah,
Yeah.
we don't want that to transition over to the clients. We want them to, it's amazing to me sometimes when I go in places and like I was in a store the other day and the lady was like, "Yeah, you can just go over there and get something." And I was
Yeah.
like, "Wow, that's not good service." Like there's
Yeah.
a
Yeah.
huge opportunity there, and it was totally missed. So we want them to like interacting with us and coming back to us, and yeah, that's one of them.
Yeah. Clients know and can repeat my name.
Yes, I think it's important that they know who they're interacting with, who their point of contact is, and again, we want them leaving Google reviews and referencing the people that have done great. We actually bonus our employees when people leave them Google reviews. So
I love that.
yeah, it's great.
Yeah. And here's what's funny too. When I was in the field, the first thing I would do, I would say, okay, so you have a Medicare plan. They would say, yes. I'd say, what's your agent's name? And I'm making up statistics, but 94% of the time it was, I don't know. It was a guy, he drove a car, he had a face, and I knew I'm taking that business
Yes.
because if they don't know his name, they're going to know my name. Right.
That's
So
funny you say that because at events I'll ask the same thing, and if they don't know their agent's name, they're free
they're
for
up
the
for
taking.
grabs. Yep.
But if they do, I applaud the agents that are doing well. There are a lot out there, but not enough. A lot could be doing way better.
Yeah, 100%. Greet clients by their preferred name. You talked about that already. It is cool. I joke. We you and I are about the same age. I think I'm older than you. I'm going to say that anyway because I'm a gentleman. But I still struggle. My kid will call me and I'll go, "Hey, this is Dallas," and she'll be like, "Dad, I know it's you. I called you. Number two, I know you know it's me." I'm like, "Shelby, it's how we were trained, man, back in the day."
Yeah.
So we have to get used to making sure that we say their name.
I
Um,
was real quick side on that. Dallas, we had one gal come into the office and I called her by her legal name. I didn't realize she went by a nickname. And she mentioned it at the time, so I changed it in our system right then and there. And as she was walking out the door, I said, "Bye, Julie," or whatever her name was. And she had to call back in. She forgot something. And so Tamani answers the phone and she with her preferred name. And that alone, she was so impressed and like raving about it on the phone with us at that moment.
yeah, and that's important too. And man, yeah, if for example my dad's name is Glenn Edward. I didn't know that till I was like 11 years old because everybody calls him Ed. And he's like, I love it because if somebody calls and asks for Glenn, they're not talking to me, right?
Exactly.
Like nobody
Exactly.
knows me like Glenn. Um, you've got a lot on here and we've got to wrap it up, but I do love that you have the word besties on here. We know our client like we know our besties. And so that's
Yeah.
different. I love that.
I mean, if
Um,
you know where are they taking vacation, who are their grandkids, what's their pet's name, it just gives you more to connect on later.
yeah. We connect clients to non-Medicare benefits and add aid and resources. Talk about that.
But we serve a lot of low income people, but higher income too. Like if there's a tax refund available, to seniors that maybe they're not getting, we will put that out there. Dental grants, maybe they've used all the dental benefits in their plan and they need more, so we'll help them fill out the paperwork. We tend to have a lot of Medicaid clients. Because we know how to identify them and get them qualified for other types of Medicaid. So we just go above and beyond things that are not income generating for us, but lead to a lot more, well, stickiness. They stay with us and they refer their friends.
Man, there's some good ones on here. Clients are never directed to call carriers. Call us. We connect clients to non-Medicare. We proactively help clients get the most value from their plan. The last one on here I love. We take detailed, personal, and accurate notes every time. Why is that important?
When you have 100 clients, you're going to remember all of them. You get to 1,000 clients, you cannot possibly remember everything about everyone. But we just want to know what's going on with them and ask them the next time. Really, we do care. It's just hard to remember everything about 1,000 people at a time. And that's how I want to be treated when I go somewhere too. Those are the things
Yeah.
I want to see. That would keep me loyal.
Isn't it crazy? You mentioned Chick-fil-A. I do believe, and I don't want to be this guy, but I will fight somebody over Chick-fil-A versus all the other ones out there. Like, I believe it's the best tasting chicken sandwich on the planet. And if you don't, that's okay. Like, get right with Jesus. It's all right. But I, I, I don't think it's just their food, right? Like, it's a chicken sandwich. Let's be honest.
Mm-hmm.
3 pickles, deliciously buttered bread, and peanut fried chicken. That's it.
That's it.
It is beyond that. It's the my pleasure. It's the okay, let me get that. Or you know what I mean? It's the I'll never forget. I went to Chick-fil-A one time and I pulled up to the window and I realized I do not have my wallet. I don't have any money. And I told him, I said, look, I'm sorry. I didn't realize it before I ordered. I don't have my, and the guy goes, oh, it's on me without hesitation. Right.
Wow.
And
Nice.
I've done that 50 times. No, I'm just kidding. I asked the guy, I said, hey, do you guys train to do that? He said, yes, sir. He said, we train if they don't have money. Guys, don't go use that. Don't go Chick-fil-A. But he said, it happens at least once a day. And it's our pleasure. Thank you. Have a great day. And
what
so,
a nice policy. I mean, I only ever see smiles when I go there. Never a frown. And the people look like they're having fun and enjoying their jobs.
Yeah, they do. And I said all that to say this. One thing that I want to bring up that you said earlier, how you set yourself apart. You can't really do it by product. You can do it by product knowledge, right? You can be very well versed on your product. You can't really do it by going above and beyond. Like, you have to stay within the CMS guidelines, right? You have to do all that stuff. You have to follow the scope and 2 days later and all that stuff. The biggest way that you can set yourself apart is that list that you have right there, that customer service that gets the referrals, gets the retention, all the good R's, the residual income, all of that comes from that. So I love that you've made it a point to establish that, not just with you, but with your agents and your members, your team members. So
it makes a
great
difference,
job.
and all of it comes back to you. All
it
that
really
good
does.
comes back to you.
It really does. Well, Amanda, if we want to get a hold of you, if you are, guys, I've mentioned several times, this is not a recruiting podcast. However, if you are looking for a mentor, and here's the funny thing, I have introduced people to Amanda before, and she's came back to me and said, Dallas, they don't fit, right? Like and I appreciate that. And I'm like, okay, yeah, perfect. It's not a fit. It's not a fit for you or them. So it's a good thing for both of you that you're saying no. But Amanda does not take everyone. You're not looking to grow a 500 team agency and just take whoever you can. You're looking for that individual that will do the things that you've laid out here. If people do want to get in touch with you, what is the best way to reach out?
If agents or prospective agents want to reach out to me, probably my cell phone, which is just 913-832-2877. Or you can send me an email at amanda@insure-integrity.com.
The fact that you're able to call yourself Integrity is just awesome. I love it. Like, there's another one out there that there's another Integrity.
They weren't so big when I started.
Yeah. She's been around for a minute, so they grandfathered her in. I love that. Amanda, thank you very much for being on. I appreciate you guys. This has been some gold. Like, you guys actually heard a presentation from a top Medicare producer, one of the top agencies in Colorado, maybe in the country, and absolutely doing it, killing it. You heard her presentation and how she retains clients. So Amanda, thank you very much.
Thanks for inviting me on, Dallas.
Absolutely. Guys, we hope this has helped. We hope this is something that you can take, use, implement. I say it all the time. It don't mean a thing if you don't make it sing, man. I don't know what that means, but you understand what I'm saying. If you are not implementing the things that you're hearing on here, you might as well be listening to another podcast or whatever. Please implement. And then the second thing is, please tell us about it. We want to hear what you are doing because you heard it on this podcast. It keeps us going. It gives us ideas. If you know somebody that should be on the podcast, if you have an idea for the podcast, go to our website, MedicareSalesPlaybook.com. Drop it in there. There's a place where you can go and drop ideas and potential guests. We'll look at them. We'll appreciate them. A big thank you to Adam back in the studio helping us out. Amanda, thank you again. Appreciate her being on here. I know you took something away. Go implement it, and we will see you next time on the Medicare Sales Playbook.